so much work, especially when you're rushing to do it. Like, I cleaned this entire place thoroughly in like, I don't even know how long it took me. I feel like 30 minutes because I was just like, you know what I'm saying? But anyways, I got all cleaned up. My hair is still wet because I just took a shower, but my face is dead, so it doesn't look as horrific as it did earlier. And my hair, oh my god, y'all saw that, right? Yeah, anywho, let's get on with the video. Welcome back to my channel. Today's video, I'm going to be talking about my first week of my new job as a new grad travel PT in a skilled nursing facility. And might I add, during a pandemic. It was a little crazy. Honestly, there's only one word I can think of to perfectly describe the entire week, and that word is chaotic. Most of it was good. There were some not so good moments, but for the most part, it was all good. Being in a skilled nursing facility, you really have to be adaptable and also be willing to throw yourself into any situation, because honestly, you never know what is gonna happen. Every day is completely different. Like the new patients that come in that you have to evaluate, you never know what to expect. I mean, just like in any other setting, to be honest. But a SNF, I feel like, is a whole different beast. But being a new grad travel PT in a SNF during a pandemic adds quite the spin. They don't really teach you how to be a PT during a worldwide pandemic, but they do give you the knowledge, skills, and confidence to adapt to most situations and think on your feet, which is what I've had to do a lot of this first week, and I'm sure I will continue to do it throughout the entire contract. So before I get into the dirty details of the first week, let me just give you a little bit of background information. This might sound really bad. I have no clinical experience being in a skilled nursing facility. I was supposed to have one clinical experience where I was going to be in a SNF, but then that got dropped, so I tried. I did have one clinical experience in an inpatient hospital, and I really enjoyed it, so I thought I might enjoy being in a SNF. So I just decided that I wanted to try it and just throw myself in there, which is literally what I did. Between both the facilities, and yes, I'm working in 2 facilities, there are great therapists there, other therapists like PTAs, occupational therapists, certified occupational therapist assistant, speech language pathologist. Between the 2 facilities, I'm the only full-time physical therapist. There are a few like PRN PTs there that come if they need extra help or if for some reason I'm not there one day, but I am covering both these buildings and it has been exciting. Quite the adventure so far. My first week has been absolutely insane. Like I said earlier, chaotic, but I feel like I've handled it very well, to be honest. Kind of proud of myself, not gonna lie. Now let me give you the details of my wonderfully crazy full first week. So day 1. So I actually started on a Friday. I know that's kind of crazy, but it's just sometimes the way travel contracts work. So I show up at the first facility. Let's say facility A, facility B. Because like I said, I'm gonna be going between 2 facilities. So I show up at A. They have become COVID positive facility, and the other facility B is COVID negative, so I cannot go in between the facilities. So they send me over to facility B, which is negative, and for me to stay there for 2 weeks until the other place hopefully becomes COVID negative. So anyways, I get to facility B. They want me to immediately start treating. I was like, do I not get an orientation or anything? Like what? I asked that straight up. She tells me to log into the documentation system, but I don't have my login information. So I was like, I can't log in, I don't know my username or password, I don't have any of that. She's like, what? I'm talking about the director of rehab. She's like in charge of, you know, getting me all settled in and whatnot. She's trying to take care of that. OT, occupational therapist, decides to like show me around, kind of show me how the documentation system works on her computer and introduce me to the nurses and some of the patients. So I have to, you know, I feel a little bit more comfortable before I just get thrown in there and start treating patients. So I'm just sitting around and I'm getting paid to sit around. So the first day's been kind of nice, you know, just chilling, getting to know everybody. But eventually my login stuff comes through and she's like, okay, you have just 2 evals to do and then after that you can go home. The OT also had to evaluate them. So we tag teamed them together. The first eval was pretty simple evaluation, so we get done with that. And then the second eval was quite interesting. Disclaimer, let's just clear this up before I keep going, talking about evaluations and patients. I will never use any patient identifiers. That will be breaking HIPAA. And if you don't know what HIPAA is, it just basically means I cannot share any information about patient. Anything that will identify them, like saying their name or their address or their birth date. So basically when I talk about patient, it's just going to be very general information like, oh, it's a female, it's a male. This is their condition, this is what they have going on. Maybe I'll talk about the findings of the eval. I just want to clear that up real quick. Okay, so the second eval was something nobody in that facility has ever seen before. We had to evaluate a man who was nearly 800 pounds. The OT did her evaluation for us. She mainly focused on the upper body and what he could do. Could he reach to brush his hair, brush his teeth, or reach for food and feed himself, you know? But for me, I was sitting there there's nothing I can do. I honestly physically could not even lift his leg to check range of motion or his strength. He was so weak. He had not walked in years. He couldn't get out of bed himself. I was lost. I was I have never evaluated, a bariatric patient before. He honestly left that weekend. That was that. So that was day one. So day two. Day two was pretty simple. I evaluated and treated some patients. I only really have one interesting story to talk about for a Monday. So there was one patient I had to treat. She was a little elderly lady and she has dementia. So I only have a little bit of experience treating patients with dementia, but usually it was only mild. But I never really treated anybody with moderate to severe dementia. And let's just say apparently this facility has a lot of patients with dementia. Anyways, I go in there to treat her, and the goal, I just wanted to get her out of the bed into a wheelchair. I just want to work on transfers. I keep asking can you sit up? And I just want to see what she does. And she doesn't move, so I was okay, I'm gonna help you. So anyways, I go to help her sit up. She doesn't give any effort to help. I do all the work and I'm sweating so much. I get her sitting to edge of bed. So she sits there, doesn't move. So I, help her scoot closer to the edge of bed. All right, we're gonna get in this wheelchair. So I try my best, give simple commands to get ready. We're almost about to transfer over. And then she decides to lean back and lifts up her feet and crosses them like that. And I was no, put your feet back down, I'm gonna flat on the floor. So we do the same thing, I'm about to transfer her, and then she does the exact same thing again. And I was girl, all right, we're just gonna work on bed mobility because honestly my time's run out because it took me a long time to get her up. So yeah, we just worked on bed mobility rest of the time and it seemed like she enjoyed herself. And that was it. Day 3. Absolutely crazy. This was the start of all the craziness. Oh my goodness. So I'm at facility B, which is COVID positive. Facility A now has become COVID positive as well. So now they want me to, to go back and forth like originally planned. So that's what I do. In the morning, I show up at facility A. I just had one evaluation to do at facility A. That one evaluation was so difficult. It was so hard to do. So this man comes in because he had fallen down. Apparently he slipped and fell. That's the only detail I got in the medical record. He has dementia. And he also has other comorbidities like COPD, hypertension, all that unlovely stuff. So I get in there, I wake him up. I hate doing that. I hate when patients are asleep and I have to wake him up. But anyways, I wake him up because I have to get this done. He's like, what? And I introduce myself, tell him I'm a physical therapist. I'm here to evaluate him. He doesn't say anything. He literally just falls back asleep. So I was like, wow, this man's is very lethargic and tired and probably really annoyed with me already. So anyways, I have to keep waking him up. He keeps saying what? He gets more and more annoyed every time I have to wake him up. And I was really scared, he was gonna get aggressive and was gonna punch me in the face. Because let's just say, I did not feel like getting punched in the face by an elderly man that day. Not any day really, but I was scared. So I asked him, the normal cognitive questions. He could only tell me his name. He didn't know where he was. He couldn't tell me the year, month. He could tell me like the situation, what happened to him while I was in there. Testing his range of motion and his strength was not happening. He was not following any instructions that I was giving him. Got what I got, and I tried to get him to roll over to sit up, and he refused. Oh, and also I forgot. So I did check his vitals before doing any of the examination stuff, and his heart rate was 110, just laying in bed at rest, and his SpO2, his oxygen in his blood, was 87. So I was like, this is not good. So of course, I told the nurses about it. I'm not gonna get him up. For one, he doesn't want to. Two, his SpO2 levels are way too low for him to be doing any activity. So I just was done with the evaluation. So once I get done with the evaluation at facility A, I have to go over to facility B. So I walk in there, and it is, once again, chaos. Because there are so many patients to see. The caseload is full. And the PTA, there's only one. The PTA is out because apparently he had an infected ingrown toenail. And so the doctor put him on bed rest for 2 days. So it was just me seeing all these patients. And I was completely slammed all day long. Like, it was go, 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 non-stop. I honestly don't even know if I actually ate lunch that day. I don't remember. I do know I didn't get done until 7 o'clock that night. It took long because I don't know any of them, so I had to like chart review them, look at all the evaluations, the last treatments. But the next day was the exact same. Day 4. Again, chaotic, crazy mess of a day in a good way. There's just a lot of patients to see. It's just me, no PTA. But I survived thanks to the other wonderful therapists that are there to help me while I'm still adjusting to the place. Like I said, it's only my 4th day, and there's a lot of patients on the caseload to see. One person I helped treat with the CODA, Certified Occupational Therapist Assistant. We tag teamed a man who weighs a little over like 500 pounds, and his main goal is to stand. So we get him in the therapy gym, and he uses the parallel bars to pull himself up with. And I'm on one side, and the other therapist is on the other side. And so we tried 3 times to help him stand up, and it doesn't work. The 3rd attempt, he couldn't do it. He was torn up. Like, it was so sad to see. And he was just like sitting there in his wheelchair. He had his eyes closed. He started like praying to God to like help him stand. I was just like, oh, man, it was a beautiful moment. And whether you're religious or not, it was very motivational to see, because on the 4th attempt, he stood up, and it was so cool to see. I was like, low key, no, like for real, I was about to tear up. It was so cool to see. This is the first time I've ever met this man, but I was like so proud of him. So he stood for like 10 seconds, and then he had to sit back down, and that literally wore him out. He was done for the day. I'm so proud of him, and I cannot wait to work with him again. So that was day 4. Day 5, that day stressed me out because of 3 patients. I swear I was gonna have a heart attack at the end of the day. Let me just tell you. So the first patient, I had to evaluate her. And she comes in with a broken femur that got surgically fixed. She's pretty young and pretty active before all this happened, but she also still has like a lot going on. I think she had like kidney issues, and there was like some other things going on. But anywho, so I go in there, evaluate her, do this normal history, check her bed mobility, then I get her sitting to the edge of the bed. Of course, I'm being careful with her leg, and I check, strength, range of motion. So she can only weight bear 55% of her weight on her leg. So we stand up, and I keep telling her like, just stand up on your toe, don't put like too much weight on there. But she's completely coherent. She understood. I forgot to mention this. So she gets orthostatic hypotension when she goes to change position. So basically her blood pressure will drop and her heart rate will go up. And that will cause dizziness and can possibly cause her to faint, also known as syncope. When she gets up from lying on her back to sitting up at the edge of the bed, I assess her blood pressure and everything. Everything looked good, nothing was crazy. Okay, I was like, do you feel dizzy? And she said yes, she felt dizzy. I was like, okay, we'll just sit here until it goes away. So eventually it goes away. And then I'm like, okay, let's stand up and see if we can at least transfer over to the chair. Stands up, and she immediately gets dizzy. I don't have time to like assess her vitals because she has to sit down already. Like, she got so dizzy. I was like, are you okay? And like, we can sit here and rest for a minute and see if it goes away. But it doesn't go away. Like, her head is like down like this. She's not looking up. She won't look up at me. I'm like down here, like looking at her face, trying to get her to talk to me. I'm like asking her questions. She can't even say her name. I was like, my heart dropped. I was like, oh my God, what's happening? Like, I mean, I knew what was happening, but at the same time, I was like, it caught me off guard. And then again, I was thinking about other like worst case scenarios. I was like, okay, what if she's all of a sudden like something happens? She's having like a stroke or a heart attack or something, like something bad is happening. So I like lift her up, put her back in the bed. So I got a nurse. We came in immediately, and she was awake and she was talking to us. I was freaking out. The nurse was like, oh my God, girl, you scared me. And I was like, oh. She eventually fully recovered. Yay! All right, on to story number 2. The second patient I just had to treat tells me that she got sick a couple of days ago and she hasn't walked, and she wants to walk. So I was like, okay, we can walk. Of course, I like test her strength. Her legs are pretty weak, so I have her stand up, and she's able to stand. She's able to like, weight shift. So I was like, okay, let's just walk in a room. We'll just go to a door and go back. And so that'd be about like 20-25 feet. We're walking. She seems super cautious and like nervous about it, but she wants to do it. So I was like, just take it easy, just take it slow, you'll be fine, I'm here. Gotta turn around from the door, and we're walking back. And then as we're walking back, I can tell like her leg, something was not right. Like something was not looking right. I was like, she looks like she's really fatiguing. And I was like, all right, we're really close to a wheelchair at this point. I was like, all right, we're here. So all right, let's turn around. So anyways, we're turning around. And she's going, and all of a sudden, her left leg buckles and she goes down. She's going down. She is going down. I was like, no. So I have one hand on the gate belt, but my other hand quickly grabs the other side of the gate belt. She's pretty close to the wheelchair, but because the way she falls, like she basically tries to fall like straight down, and she would have missed the edge of the wheelchair and probably fallen on the floor. So I had to muster up all the little bit of strength that I had to put her into the wheelchair so she doesn't fall on the ground. We were both shook after that. Like, I stayed in there with her until we both like calmed down. We were both like, oh my God. Like, the last crazy moment of the day. This has all happened at facility A. So I get to facility B. So anyways, I do some treatments and then I have one evaluation to do at the end of the day. So I do that with the OT. And this is a patient with dementia, and his medical record did say he was combative before. So I'm like, okay, all right, well, we'll see what happens. Anyways, the OT was in there with me, and she has to leave to go get some clothes to change him into. I'm in there just asking him questions, see what he can answer. He can only tell me his name, and he won't answer any of my other questions. I want to, look at his strength, look at his range of motion, see what he can do, like his bed mobility. He's not being cooperative whatsoever. So I was like, okay, well, so I want to get him sitting to the edge of bed. So he has no socks on. So I was like, okay, let me put these sticky socks on. So if we can get you to stand, you don't slip and fall. So anyways, I put one sock on one foot. Then I go to put the other sock on the other foot, and he like violently snatches his foot away. I'm not doing it, like it's just a sock. I'm just gonna put this on your foot so you're safe for when you stand. And he brings his foot back down. He's looking at me, so I was like, okay, hopefully he understands what I just said. So I try again, and again he like moves his foot really quickly. I was like, oh God, is he like really sensitive? Like, is something going on like with his sensation? OT comes back. I was like, look, I can't get the sock on him. So she says something, I forgot what she says, but she was able to put the sock on. Now we have to sit him up so we can both assess him. So the OT, she's had more experience in this and with these patients. So she takes over. All right, we're gonna sit up now, and he won't do it. So she's like, all right, let me help you. So he starts to lean over, like, all right, let's roll over. And he throws hands. Like, he starts slapping and grabbing, and his legs start kicking, and I have to like dodge his like feet from kicking me in the face. Like, okay, he's obviously pretty mobile. His range of motion is good because he was just going off. I am so glad the OT was there because I honestly would not have known what to do. I probably would have just been like, okay, you can lay there, I'm gonna leave now. She handled it so beautifully. Like, she calmed him down. We were able to sit him up, get him dressed. We were able to get him to stand up, and he was able to walk. He did great. He did great with all his mobility. Everything looked good. I mean, he's just a very, very confused man because, of dementia, which is really sad. But yeah, so that was that. So that was day 5. On to the last day, Friday. So day 6. Honestly, for the most part, it was pretty chill. But I do just want to talk about this one lady. Me and the OT had to evaluate. I think it was just like a reassessment. So we go in there. She lives at the facility, but she was so cute. So she also has like dementia, but she is pleasantly confused. Evaluate her. I do my thing, OT does her thing. From my point of view, from a PT point of view, her mobility, strength, range of motion, phenomenal. For her age, beautiful. The only thing is she's just confused. That's the only reason she's at that facility, because she's not safe to go home because she just, has cognitive impairment. But mobility wise, she literally was dancing in the room. It was so cute. That was Friday, and that was my first week as a travel PT in a skilled nursing facility during a pandemic. It was a lot, to be honest. It was pretty crazy. It was a lot to absorb, a lot of information to process, and I honestly didn't realize how overwhelmed I was until today. Until this morning I woke up, I was just like, what? Like, I just took, this is why I'm filming so late, because I took the entire day to just chill. I read a book, and I stopped reading maybe around 1 or 2 o'clock. It was just so good. Highly recommend that book. That was it. Thank you so much for watching my video this week. Like always, make sure to hit that like and subscribe button down below. Help your girl out, please. Thank you. And stay tuned for another episode next Sunday at 7 o'clock. Hope everyone has a wonderful day, night, evening, whatever. Okay, bye. I'll be honest right now with my outfit I have going on. I don't know why. I feel like a young, sassy soccer mom. Is that weird to say? I don't know. Because I'm wearing this white shirt. I'm wearing this watch. I'm all black and white. I don't know why. And then I have these Nike shorts on. Yeah, you see that? Okay. Yeah. I just feel like I should be one of those moms that stands right at the sideline, close to the coach, right behind the coach, just standing like this, watching her son or daughter out there kicking butt, because she has the best kid on the team, because she practices with him or her every day, and she's just on the sideline screaming, yelling, go little Timmy, go, do not pass that ball, you keep that ball, don't you let them steal that from you, no, Timmy, you score all them goals like your mama used to do back in the day. Timmy, did he just nutmeg you? Did he just make you? I think that's all of this. I need to go, so okay, bye.